Acute lymphoblastic leukemia is the most common cancer that affects children. The form of t-alall leukemia that emerges from the initial T-stool cells has a worse prognosis than B-Lineage all. Prognosis for recurring t-alall is very bad, and new therapy is needed. A joint study by the Faculty of Medicine and Health Technology of the University of Tampere in Finland, the General Research Institute of Massachusetts, and Harvard Stem Cell Institutes found a new combination of effective drugs against t-alall. This finding is based on previous discoveries made by Tampere University Research Group, where the inhibitors of the general Tyrosine Kinase Dasatinib were found effective in about 1/3 of the sample of the patient being tested. In the treatment of leukemia, the efficacy of a single drug usually disappears rapidly, so that new studies are looking for a combination of drugs that will have an upgraded synergistic effect with dasatinib. This is a case with t-alall, a drug that inhibits parallel signaling pathways. The combination of the two drugs is more effective in eradicating leukemia cells in zebrafish and human diseases than using a single drug. During this study, we developed a new drug screening method for the rapid assessment of drug response in the sample of zebrafish leukemia. On this screen, an effective combination of drugs is found, which is then confirmed by several cell line models, patient samples and human leukemia planted on mice, said PhD Sara Laukan, the first author of the study. This has become a long project. It takes 4 to 5 years, and as a result, we now understand the mechanism of the action of these drugs at the molecular level at t-alall, Laukan added. During the project, he spent 6 months as a guest researcher at the pathology department at the Massachusetts General Hospital in Boston with the research group Professor David Langenor, with whom the project was carried out. He worked widely with PhD Alexandra Veloso, a researcher at the Langenor team and the writers co-lead at the job. This is a promising new treatment choice for T-acute leukemia. The next step is to bring discoveries into clinical practice for patients with recurrence or refractory diseases through the clinical trials of the initial phase, said Research Director Olalohi, MD, PhD, from Tampere University and Tays Hospital Cancer Center. Development of slow precision care and requires accurate knowledge of molecular mechanisms that cause and maintain dyes.